Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. We're continuing our coverage on Heart Health Month today. So joining us this morning, we have nurse practitioner Jamie Trumbull. Jamie, thanks for being here this morning. How are you?
I'm good, Blake. Thanks for having me.
Yes, of course. So most of us, we know what a heart attack is, but can you share a little bit more about other heart conditions like A-Fib and the complications that go with it?
Yeah, so A-Fib is a heart rhythm disorder. Actually, approximately over 6 million people in the U.S. are affected by A-Fib, and that's projected to increase to over 12 million by the year 2030. So historically, we kind of thought of A-Fib as a little bit more of a nuisance rhythm, and now we know that's not necessarily true. A-Fib actually puts patients at risk for stroke, cardiomyopathy, or weakening of the heart muscle, and heart failure.
Wow. Okay, so it's something you don't want to mess out for. Some types of symptoms to look out for. How do we know in A-Fib?
So symptoms can be very broad. Some patients are completely asymptomatic, which means they have no symptoms at all.
Okay.
Other patients tend to feel what we say palpitations, or they'll say they have a racing sensation, flip-flops, flutters, shortness of breath, dizziness, lightheadedness, chest discomfort, and activity intolerance.
Is there a big difference in symptoms with A-Fib and symptoms in a heart attack?
Some of them can overlap, and they can be a little bit vague, so it can be confusing sometimes.
So if someone is experiencing A-Fib besides all those, how do they know where to get diagnosed? Is that something they do themselves? What does that look like?
So sometimes patients have what we say an incidental finding, so they're not aware that they're in A-Fib. They come to the hospital or they present to their physician office for kind of vague symptoms. Typically you do an EKG, which is an electrical picture of the heart, and that's how we can tell that patients are in an A-Fib.
Okay. And then treatment options, is there any available?
There are treatment options. First and foremost, patients typically are placed on something called anticoagulation or blood thinners to help protect them from stroke, because that's one of the biggest risk factors for A-Fib. Otherwise, we look at two different strategies. We use rate control and rhythm control. Rate control means that we use medications like beta blocker or calcium channel blocker to try and control how fast the bottom chamber of the heart or the ventricles are beating.
Okay.
Rhythm control means that we're trying to keep the heart in normal rhythm, and we can do that with medications like antiarrhythmics. We can do cardioversion, where we shock the heart back into normal rhythm, or catheter ablation, which is a minimally invasive procedure and really the preferred treatment, where we take catheters into the heart, we find where the areas of A-Fib are coming from, and we use heat or freeze tissue to create scar or a roadblock, so A-Fib can't produce itself anymore.
Wow, this is very intricate work that you guys do, so thank you. It's very important. Is this, just out of my curiosity, is A-Fib something that can affect anyone no matter age, or is it more so older patients, younger patients?
Yeah, that's a great question. So age is a big risk factor.
Okay.
We're starting to see people over the age of 60, but mostly over the age of 65.
Okay.
Other risk factors are obesity, obstructive sleep apnea, chronic diseases like diabetes, hypertension, heart disease, excessive alcohol intake, thyroid disorders, European descent, and they're even looking now at genetic components. So we know that if a first-degree relative has A-Fib, then it places you at risk for A-Fib.
Yeah, it's almost like the breast tissue tests.
Exactly.
Okay.
So they don't have specifically one gene that's polygenic, so there's multiple genes involved.
Wow. All right. So learning so much more about this. This is fascinating. And Jamie, tell me a little bit how long you've been working as a nurse practitioner in this field, and what makes you so passionate about the work that you do and helping our patients?
So I've been a nurse practitioner for over 10 years. Historically, I was a nurse previously, and I've always worked cardiac. It's just always been something that I'm passionate about. And I love helping people. So anything that I can do to be there for patients when they're going through difficult times or stressful situations, I just think it's nice to have someone who shows them that they care and tries to explain things to them in a simple way so it's understandable for them.
Well, thanks for coming on right now and explaining it in a simple way for us to understand this morning.
Yeah, you're welcome.
Yeah, of course. And if you want to get any additional information on today's topic, you can head over to the Hot Links page that's on our website at WNEM.com.